How's it going, everyone? Uh, this is for General Anatomy Dry Lab, and this is your answer key for these self-study questions that were provided to you on the assignment for Dry Lab last weekend. So what I thought I would do is go over each slide and provide you all with the answers and maybe a little bit of explanation for why those answers are correct. So for item 1, name this vertebrae along with its specific spinal level. And this is the axis vertebrae at level C2. And this is a very unique vertebrae. You can see a lot of features going on. And the next question here is to identify 4 bony landmarks on this vertebrae. And of those 4, 2 are to be unique to this vertebrae. So knowing this is C2, we're looking for those specific landmarks that are true to the cervical spine. Okay. The 2 unique landmarks are going to be your dens or odontoid process, labeled A in this picture, and then the bifid spinous process or bifid spinous process, where this spinous process comes and meets together and splits into 2 for those muscle attachments found there. So those were the 2 the 2 unique landmarks that were specific to this vertebrae. If you have some others, feel free to share them at the next lab, but those were the 2 that I was trying to hone in on. Now this next question is quite lengthy, and I'll use some visual aid to help go over it. List 3 muscles that attach at this vertebrae, including the actions of each muscle listed. So I only asked for 3, but there are quite a few. There are more than 3. So I'm going to go over them, and I'm going to do it in a way that's layered, a layered approach. Okay? So starting with the most superficial layer of back muscles, the first muscle that attaches at C2 is the levator scapula, and it attaches on the transverse processes of C2. Okay, if I pull up a picture here into the superficial back muscles, you can see levator scapula is number, where are we at here? Levator scapula, number 10. So this orange muscle right here, and that attaches right there. If you can see my cursor, I'm kind of hovering over the transverse processes at C2. The actions here are going to be to elevate the scapula. It assists in rotating the glenoid downward. Okay. It extends the neck when it's contracted on both sides, laterally flexes the neck on one side or the same side, and rotates the neck on the same side. That's the levator scapula. The next, going a bit deeper here into the splenius group, is the splenius cervicis. You can see splenius cervicis labeled number 2 here. See if I can blow that up. Number 2 attaching to C2. The splenius cervicis serves to extend the neck or the cervical spine on both sides, rotate to the same side, and laterally flex to the same side at the cervical spine. Moving a little bit deeper, we get into the erector spinae, and at the erector spinae we have the longissimus cervicis. And the longissimus cervicis is number 10, so you can see that attached there at the transverse process. Okay, and that is going to extend on both sides, laterally flex to the same side, and rotate the same side at the C-spine, much like the splenius cervicis. Staying in that same layer, we move on to the spinalis cervicis. Spinalis cervicis attaches at the spinous process of C2. It's number 5 here, kind of blurry, but you can imagine how that attaches at the spinous process. And because it attaches right dead center in the middle right there, when that muscle contracts, it's going to extend the cervical spine. Moving deeper, we're going into the transversospinalis group, which is deep to the erectors. And there we have the semispinalis cervicis. Okay. Semispinalis cervicis is number 2. That red band of muscle there traveling along. That attaches to the spinous process as well. So that's going to extend on both sides and control lateral flexion to the opposite and rotate to the opposite. Multifidus cervicis is next in that same layer. That's going to be number 4. And you can, really hard to see there, but you can imagine. Multifidus cervicis, again, extending both sides, controlling lateral flexion, and rotating opposite. And then we get really deep into the segmental muscles here, and I think I passed the image into here. And we have the interspinalis, which is going to extend and responsible for some postural control. And the intertransversus, anterior and posterior. Okay. Intertransversus. And that is going to extend the anterior portion, and the posterior anterior are going to laterally flex. Those are also involved in postural control. Now, I would really focus on the ones listed in your dry lab manual. The segmental muscles are deep and tiny, and probably not as, I'm not going to say they're not as important, but you want to really know the bigger muscles that are responsible for the movements that we see a lot in the planes of motion that we all know. List 2 joints that are formed by this vertebrae. There are a few, okay, and I'm going to list the ones that I would accept as correct. I think the most obvious one is going to be the atlantoaxial joint, and that is where C1 comes together with C2. You could see the facets here where that C1 atlas is going to rest and hug around that dens. Okay, so that's your atlantoaxial joint. Now, when we talk about atlantoaxial joint, there's 3 parts to that. We have the median and the lateral atlantoaxial joints. The lateral atlantoaxial joints are what we're going to refer to as atlantoaxial, because in your dry lab manual, we have what's called the anterior odontoid joint, where the odontoid meets with the posterior aspect of the anterior arch of the atlas. And we also have the posterior odontoid joint, which is going to meet right here at this facet on the posterior surface of the odontoid with that all-important transverse ligament. We also have a joint below here, which is going to be your facet joint or your zygapophyseal joint with C3. Item 2, name the type of vertebrae pictured. This is a lumbar vertebrae. A lumbar vertebrae. Nice big lumbar vertebral body. You can see there with some of those processes, those specific features to the vertebrae coming in through here. Your pars interarticularis. Okay. How many vertebrae of this type belong in the spinal column? There are 5 lumbar vertebrae numbering L1 to L5. In between those vertebrae are your IV discs, which are going to attach to the surface here on the body of the vertebrae. Name the ligament that attaches to the area indicated by the green arrow. That's going to be your anterior longitudinal ligament. And remember what we talked about when we met last weekend, that that anterior longitudinal ligament, that anterior is in reference to the body of the vertebrae. And so the posterior longitudinal ligament is going to be on that posterior surface of the vertebrae. Name the bony landmark indicated by the yellow arrow. That's going to be your left superior articular facet of a lumbar vertebrae. Remember, because this direction is anterior, that's how we're going to reference laterality. And that's where your left superior articular facet is located. Name the joint that articulates at this site. The joint that articulates at that site is going to be a zygapophyseal joint, or a facet joint on the left side between a lumbar vertebrae adjacent or above. We don't know specifically with this picture what number vertebrae that is, okay? But that's what's going to form or articulate at that site. Item 3. Nice big picture here, really stretched out, of the spinal column along with some other bones. Name the joint indicated by the orange arrow. Okay, we're looking here, referencing the box and what's inside that box. That's going to be a right costovertebral joint between the 10th thoracic vertebrae and the right 10th rib. Okay? That's your 10th rib. And if this, because it's a bit lower along the column, I would count up. You know we have 12 ribs. There's your false rib, your second false rib at 12 and 11, and then there you got 10 on the right side, articulating there with the costovertebral joint. Remember, this could also be a costotransverse joint. I would give that too. I know this picture's not great. But we have those two attachments, those two articulations occurring there, the costotransverse on that transverse part process of the T vertebrae, and then the costovertebral on the vertebral body. I think on a test that joint would be blown up for sure, so that you could clearly see where the articulation is occurring and which one we're looking for. Name the bone indicated by the yellow arrow. Name the muscle that attaches to this area of the identified bone, as well as its innervation and muscle actions. That bone is the right scapula. The muscle that attaches there is your right infraspinatus. Infra meaning below, spinatus in reference to the spine of the scapula, infraspinatus. The innervation is going to be the right suprascapular nerve. And the muscle actions that the infraspinatus is responsible for are external rotation of the shoulder joint. It also serves to stabilize the humerus, or more specifically the head of the humerus within the glenoid, as a part of its role in coordination with the rotator cuff muscles, or in sync with the rotator cuff muscles. That's it. Thank you, everyone. If you have any questions, feel free to email me, sfancher@usa.edu. You could also email Dr. S, Dr. Griffiths, or Dr. Peeler. Thanks.